Yeah. Dr. Ashwini will be presenting on our experience with hard cataracts in the Cataract and Eye Care Camp of Andaman Islands.
Thank you. Good morning, everyone. I'm Dr. Ashwini Meherda, Chief Medical Officer from Safdarjung, New Delhi. It is a privilege for me to present our experience with hard cataract in Eye Camp of Andaman Islands. No financial disclosure. Why was this camp was needed? This camp was needed because there is a scarcity of government eye surgeon and facilities from the last 5 years. And it's a larger tribal population with lower socioeconomic strata and more of smaller islands. And assessing these patients to the mainland was very difficult for them, and also challenging, and also referral was very difficult. And we also found with higher grades of cataract and ocular comorbidities. So the Government of India, the Ministry of Health, organized this camp in J.B. Bant, Port Blair Hospital, and from January to February 2024. There were 3 teams in it. I was in the second team with a team of 3 surgeons, and we operated nearly about 180 patients. And we encountered mainly with the hard cataract. Both SICS and phacoemulsification surgery was done. So our study was to evaluate the outcomes of SICS versus phaco in hard cataract of Andaman population. So that it is a retrospective descriptional study, and the sample size of 160 patients was included in my data. 2 groups divided into SICS and phaco. In SICS, we have done 95 surgeries, and phacoemulsification 65 surgeries, based on the surgeon preference. Now, the inclusion criteria, mainly the cataract was grade NS3 and more according to Locke's classification, but we also excluded the diseases of glaucoma and retinal diseases around 20. So we have operated only 160 patients, which is included in my study. Pre-op workup was done, fundus examination, B scan, blood sugars, urine. B scan is very important for me since I'm a retinal surgeon also. So whenever I see hard cataract, I do B scan to rule out vitreous hemorrhage, diabetic retinopathy, or is there any RD. So the parameters analyzed were demography, grade of cataract, and the vision preoperative day 1, day 7, and also the cornea clarity. The results, the males were more in both the groups, SICS and phaco. And the mean age group was 65.3 years, ranging from 50 to 75 years of age. The grade of cataract both in SICS and phaco was NS5 grade and 52% and 51% in phaco. So the preoperative vision in both the group SICS and phaco, it was only hand movement close to the face to counting finger 3 meters. So this is my small clip of my surgery, which I want to always prefer to go for SICS whenever I see the challenging hard cataracts, especially when you don't have retinal infrastructure, no retinal surgeon, and for this place also they have to go to Chennai, and it takes around 2 days to go by ship. So it is very important to go for SICS if you don't have backup for retina surgeries. So the challenges which we have faced are very important. Some of them are poorly dilating pupils, there was journal of weakness with phacodonosis, there was a pseudoexfoliation, mature cataracts, and also in some cases they were subluxated. So this was one of the cases, a 70-year-old man, it was total hard cataract and was anteriorly dislocated in the pupillary margin. So I decided to take it out and do the SICS, and luckily I was having the same power of iris clawless, and I implanted into it, and the vision came out to be 6/36 on day 7. The post-operative vision, which I found out in SICS and phaco comparatively of 6/12 and better, was improved in SICS from 75 to 92%. As comparatively in phaco, it is improved from day 1 to day 7 from 40% to 68%. And the clarity of cornea was much more better in SICS compared to the phaco. So other postoperative complication was just descendant memory detection phaco, and some rents were there, but we placed the IOL in the sulcus. We are lucky enough there was no nucleus drop and no lens drop. So we just found out that these kind of mature category found out every day we're taking pictures, and I found out the SICS group has better clarity, postoperative, better vision. Since I feel that younger surgeons are facing difficulties in doing SICS because of inadequate training. I just conclude that SICS is a safer, we all know, it's a big thing. It's a safer, cost-effective surgery for hard cataract and eye camps where long-term follow-ups are not possible. And it should be continue to be a part of resident training for handling such kind of scenarios. thanking you. This is my clip of paper taken during that camp. And it's just a question mark also for all of the doctors. There are so many heart cat in some places and there are no doctors. Thank you.
Very good, Dr. Ashwini. Your presentation is really good.
Thank you.
And it is the need of the day.
Thank you, sir.
How did you reach the sample size of 160? Was any sample size calculation done for the study?
The total we have 160, na, FACO and SICS.
Okay.
But we have excluded 20 patients because they were having other complications. So we decided only to keep that one in order so that we can compare easily the visual acuity, because we can't compare if you have other complications. You can't compare the visual acuity with SICS and FACO.
And what about the astigmatism? Was
With
there
that
any
we can't
difference?
do. We have just follow-up done up till the 7th day. Na, then
Okay.
Thank you, sir.
Thank you.
Andaman like place, you know, it is so difficult. We have gone there many times, like as a training of trainers. We went to train their doctors or whoever there. But you know, even doctors run away from there.
Yeah, same problem was there. There was one doctor and she ran away. There was no doctor for the last 5
Only
years.
thing you-
No surgery. So the government of the, I was the senior most surgeon. I went with my junior.
Great.
Thank you.
ओपन हॉस्पिटल में तुम जब कमरे हैं वहाँ तुम सोते हो
हाँ, very
समुद्र के
difficult.
किनारे
हाँ.
जिंदगी
ये
में
सब मैंने सीनरीज डाली हैं इसमें.
great. Very सुंदर प्लेस, बहुत ही ब्यूटीफुल जगह, सबको जाना चाहिए.